So the International Consultation on Incontinence, this is a process that's been running for many years, and this 7th edition I'm really looking forward to. It's always by far the most detailed overview of the field, going into depth in every fundamental aspect from clinical to science. And I think that it's a very important initiative and one that really helps as we strive for best practice, but also strive to answer the questions that are challenging us now.
The Incontinence book comprises 22 chapters with a scientific report, and it relates to all aspects of incontinence, both urinary and fecal, as well as pelvic organ prolapse. The book is intended for all healthcare professionals who are interested in incontinence, and that includes medical professionals, nursing staff, physiotherapists, engineers, and anyone else who has an interest in improving the lives of men and women and children who suffer from urinary incontinence and similar problems.
The most recent one is basically an update of all different areas of continence, the most latest research, the best recommendations, and it provides guidelines for care pathways, recommendations for service structures. But also for certain areas that you're working in, just having an understanding of the most recent research available, the recommendations, the quality of that work, and how you can then use that in your own practice is great. There's lots of different chapters covering lots of different clinical areas, but also important are the areas that aren't clinical. So there's a whole section regarding continence services, education for healthcare professionals, and all the recommendations around that advocacy. So there are some really useful leadership, management and educational areas as well as the clinical practice.
I'm really pleased to announce that the book is now finally available, and I'd encourage everyone to get a copy. That really is the Bible for incontinence, for young career researchers, for academics and for clinicians who want a digestible view of the evidence in their particular area. The product, the consultation, the final book is going to be discounted for ICS members and is available in small chapters than before. So if you have a particular interest, you can have a bespoke printed edition, particularly for your needs.
The Incontinence 7th edition is extremely important for a urogynecologist. I think, especially coming from a background of obstetrics and gynecology, I had amazing training in kind of pelvic anatomy and the pelvic floor, and through my fellowship, I realized there's so much about the bladder and the dysfunction of the bladder that we don't know. And ICS's Incontinence 7th edition really covers all of these topics, and it's right there at your fingertips to answer any questions that you may have. One of the areas that I felt I was weakest in, and I will own to this, was neurourology, and they have an amazing neurourology section where you can really prep if you're prepping for a patient that you're going to see, if you have your board exams coming up and you feel like you need to prep, or if you just feel like you want to brush up on the subject. It's definitely a great resource.
Not only obviously you have the evidence behind conservative management, which obviously helps you in clinical practice in terms of justifying your clinical role and what you do with your patients, but also, it's got all the information about, pathophysiology, pharmacological treatment, surgical treatment, clinical pathways, which is very good, especially if you're a physiotherapist somewhere that perhaps the role is not well established, to look and justify what you need to be doing, what you should be doing. So it's actually a really good book to have everything, not from the physio, but from everything related to pelvic floor. So everyone should actually try to download. Having that book is actually helped many people along their careers, and especially if you're an early career within physiotherapy or in general nursing or any of medics. That book is like the essential that you need to read.
The information in the ICI book is always very much appreciated by clinicians, by researchers, but also for related specialists, geriatricians, basic scientists, and even economists interested in the economy of healthcare.
And it's great for the ICS members, of course. They get a big reduction on the purchase price for that amazing book.